Life, after waiting months for a mental health appointment, is calling for a 2-week cap on wait times. Tamsin Abbott's daughter Phoebe visited her GP in January for self-harm, but was not referred to mental health services until April and died to suicide before another appointment was arranged. The government say they're recruiting 8,500 more mental health workers to cut delays, but Tamsin says that's not good enough.
I'm also calling for GPs to have a paediatric doctor who's fully trained in mental health, who can assess children and even medicate them on a low dose if needed, because this was the issue back in January.
A teenager who took her own life is calling for action to ensure that young people suffering a mental health crisis are seen by a doctor much more quickly. Phoebe Macias was found dead at her home in Hastings in July as she was just 14. Her family say she didn't get the medical support she needed and have launched a petition in her memory, as Peter Whittlesey reports.
Phoebe was just 14 years old when she took her own life. She had mental health problems and her parents believe she didn't get the medical support she needed. Since her death, her mum has set up support groups and tried to raise awareness of mental health issues among teenagers.
Through my chat groups, I have been talking to mums who have got children who are suffering mental health, that have either got to keep fighting and pushing, or they've not even had an appointment to see CAMHS, or they've spoken to CAMHS and been told it's 6 months, and the 6 months has passed and there's still been no appointments. If Phoebe was here now, Phoebe would want me to do this, because we wouldn't want to see another family go through what we've been through. It's just horrendous, it's horrible.
On Saturday, it was 11 weeks since Phoebe died. Her parents are calling for a review of child and adolescent mental health services in East Sussex after they claim other parents have struggled to get appointments they need. Hastings' new MP says she's looking into the matter.
Well, my heart goes out to Phoebe's family, and having spoken to them at length about what happened in Phoebe's situation, I think it's important that we look at her case and whether things could have been done differently. And I think the strength that Phoebe's mum, Tamsin, is showing us in using this situation to campaign for greater support for children's mental health is so important. We need to make sure that every child gets the support they need, and we know that mental health waiting lists are far too long at the moment.
Phoebe's parents say they're still in shock and are grieving, but want to do something to help other teenagers who are wrestling with their mental health before it's too late.
Well, Peter is here with us now. It's only a matter of weeks since she died, isn't it, Peter? And her family are still waiting for a date to be set for an inquest into her death.
Yeah, this is a really, really sad situation. But first of all, it's really up to a coroner to decide how Phoebe died. That inquest hasn't taken place. And during that process, no doubt the health agencies that were looking into Phoebe will find out what happened there. In a sort of separate issue, because of these support groups Tamsin, her mum, has set up, she's heard about these delays and in children's services with mental health.